sanctum of HMAT. Thanks to all the dignitaries. Now, moving forward in our program, I would like to call upon our President, Dr. K. Gopalakrishna Garu, to present about today's oration, the Sacrosanctum, Dr. G. Bharath Reddy Garu, and welcome address. Welcome, sir, with a big round of applause.
Good evening, ladies and gentlemen. I extend a hearty welcome to you all for Dr. G. Bharath Reddy Memorial Oration on behalf of HMAT and the distinguished speakers of this evening, Dr. Raghupati Reddy, Dr. Kavya, our General Secretary, Dr. Durga Prasad Rao, our Vice President, Dr. Madhu Varanasi, and our Treasurer and Clinical Research Director, Dr. Venugopal Gauri, and our executive members, Dr. C.V. Swami, Dr. Padmaja, Dr. Srinivas, and Dr. Ganeshacharya, and all the consultants, members, students, and invitees. I extend a warm welcome to you all to this memorial oration. We are organizing this event. Dr. G. Bharath Reddy Memorial Oration. So on this occasion, we extend our heartfelt thanks to the family of Dr. G. Bharath Reddy Garu for sponsoring this event. And Dr. G. Bharath Reddy Garu was a very popular homeopathic physician practicing in Hyderabad. So he was basically a veterinary doctor. Later, he studied homeopathy and started practicing homeopathy. He was more known as a homeopathic doctor rather than a veterinary surgeon, though he was working in the Department of Animal Husbandry and later IPM in the vaccine section. So he was really popular in entire Twin Cities and most parts of Telangana. So Bharath Reddy, whenever we used to, in our student days, if we were to say that we are studying homeopathy, so they used to ask us, is it Dr. Bharath Reddy's science. So that popular he was in this region. So he authored some books, he presented several papers, and he was a very active student leader. And he also participated in freedom struggle against Nizam regime. So he was also awarded with Tamarapatra. And he was the first homeopathic doctor to be chosen for Andhra Pradesh Public Service Commission member. So it was really a very respectable position. So he was the first person to be chosen for that. Later, another doctor, Dr. Nauman from our Jaisurya College, he was also chosen as member of APPSC. So, and he was very popular physician, Dr. Bharath Reddy Garu, and great lover of homeopathy. And he also taught few classes in Amarji Pattisramal College and as well as Jaisurya Homeopathic Medical College. So for quite a few of our teachers, he taught them, he took few classes. And on this occasion, for his great conviction towards homeopathy, we pay our heartful homage. And we also thank the family of Dr. Bharath Reddy. And today we are having distinguished speakers, Dr. Raghupati Reddy, so a very popular practitioner practicing in Bhuvanagiri and also in Tarnaka, Hyderabad for the last more than 2 decades, I think. Yeah, 4 decades. For the last 4 decades, he's practicing. He is a very popular physician, and many eminent people happen to be his patients. So on this occasion, he would be discussing on piles, fissure, and fistulae nano. So we wish we would be learning from him many of the clinical aspects of these problems. And the another distinguished speaker of this evening, Dr. Boini Kavya. So she would be deliberating on 50 millisimal potencies. So this is really a very useful tool, a new tool for many of the practitioners. So the intricacies of using 50 millisimal are once again given for us to practice easily. So we would be immensely benefited. So once again, I thank you all for having come here to participate today's deliberations. And thank you one and all.
Thank you, sir, for addressing the audience about the oration. Now, I would like to call upon our General Secretary, Dr. Durga Prasad Rao, sir, to please come to the podium and address about HMAT to the audience.
Good evening, all. Respected President Dr. Gopal Krishna sir, our Vice President Dr. Madhu Varanasi, our ICRH Clinical Director Dr. Venugopal Gauri, today's distinguished speakers and my best friend, like a brother, Dr. Raghupati Reddy, and Dr. Boini Kavya, distinguished guests, and all the doctors. On behalf of HMAT, let me pay my heartiest tributes to our master, Dr. Hanneman, and also Dr. G. Bharath Reddy, on whose name today we have gathered here to conduct this event. And Girish, you know, Dr. G. Bharath Reddy was a eminent and veteran homeopathic doctor. In fact, very sad thing is Dr. Girish Reddy, the beloved son of Dr. Bharath Reddy, who instituted the oration at HMAT, who used to attend our event, by a few years back, he died of some heart problem all of a sudden. And HMAT pays tributes to Dr. Girish Reddy also, Dr. Bharath Reddy's son. And coming to our HMAT activities, you know, the CL Modi Charitable Homeopathic Dispensary is serving the human people for the last 6 decades with the outpatient department, and specialty clinics are running for the last 20 years with eminent homeopathic doctors around the city. And other activity is we train the interns posted by the homeopathic medical colleges, And also we conduct the medical camps, preventive distributions, and also we conduct monthly memorial orations every month, last Sunday of the month, like this event on in someone's name. And also we do conduct periodical state level and national level homeopathic seminars and get the pan-India this one development. All these activities are being done by our efforts of our homeopathic doctors, our HMAT members particularly. I thank all the governing council members and also life members of the HMAT for their some continuous support. And I also thank the philanthropists who are patronizing our events and serving, helping us to serve for the cause of homeopathy for always, and we wish to do always. And I wish you everyone a happy advanced Christmas and a happy New Year. Thank you, one and all.
Thank you, sir, for addressing the audience about HMAT. Now, I would request all the dignitaries to take their seat off the dais. Thank you so much. Now, I would like to call upon Dr. Gautam Ralabandi sir, Organizing Secretary HMAT, to present about our first speaker, Dr. K. Raghupati Reddy Garu. Welcome, sir, with a big round of applause.
Good evening, ladies and gentlemen. I thank Homeopathic Medical Association of Telangana for giving me this opportunity. So coming to the first speaker of the day, Dr. K. Raghupati Reddy Garu, a native of Bongiri. He's a third batch degree student holding MBS from JSPS Government Homeopathic Medical College. Sir has pursued his MD in subject of homeopathic repertory in case taking from DKMM College, Maharashtra University. Is a senior homeopathic practitioner at Bongiri and Tarnaka with an experience of more than 40 years. Sir has received the best doctor in combined Nalgonda district on the Telangana Formation Day in the year 2014. Is popularly known as kidney stone specialist and treated a good number of calculi patients. His talks are available on the channels TV5, Health File, at TSAT, Arogya Mitra, which are already been telecasted. So we welcome sir with a huge round of applause to share his knowledge and wisdom. Welcome, sir.
Good evening, all. Respected Homeopathic Association President Dr. Gopalakrishna sir, General Secretary Durga Prasad sir, my dear friend Vice President Madhu, another friend Venugopal Gauri, Speaker Kavya Garu, all the homeopathy family members. I am thankful to the organizers giving me opportunity to participate in the Dr. Bharath Reddy sir Oration program. He was a great stalwart, legendary personality in homeo field. Even most of us inspired from his practice. When I was a student of 10th and intermediate, my close relatives are his patient taking treatment from kidney stones. That time only I decided to join in the homeopathic field. Coming to the subject proper, regarding Bharath Reddy sir, Gopalakrishna sir told regarding him. I am asked to speak regarding the common problems in the anorectal region with homeopathic management. Prior to going for that, I would like to share what are the practical problems I faced in initial days of the homeopathy practice. I practiced in different areas, rural, town, and urban. That I think that is useful to the students. initial days when I was an house surgeon, a homeopathic system is a big ocean. One is giving single dose, getting good results. One is giving single medicine. One is giving polypharmacy. One is giving mother tincture. One is giving tissue salt. Everybody is getting results. Like a Kumbh Mela and Krishna Godavari Pushkaral, homeopathy big ocean. And if we want to take a bath, everybody is getting wetting in the ocean. Like that, who is the right doctor? Who is the right person? The patient is a real judge. The result-oriented thing is right way of prescription, according to my knowledge and experience. When I was an house surgeon at Sagar Mr. Dilsuganar, one scientist and gentleman came to the store. He gave one paper to the store boy. In that he wrote one medicine. The store boy did not follow the name of the medicine. He didn't know. He brought the chit to me. Even I didn't see and didn't read anywhere that name of the medicine. Simply I said to the gentleman, sir, it might not be a homeopathy medicine. It might be Ayurvedic medicine. You go to the Ayurvedic shop nearby Musarambagh, that will available. The gentleman immediately reacted. You give her boric medica. I will show the medicine. He gave the medica, show the medicine. Previously I used this medicine for my anterior staphylococcus, enlarged eyeball. I want previously 30 potency. Now I want 200 potency. Then the name of the medicine was Homocladia dentata. Why I want to tell this? I don't comment or criticize anybody. Frankly speaking, some of the people, those who are not institutionally qualified, they are more intelligent content than institutionally qualified people. Some of the judges, some of the advocates, some of the teachers, some of the lecturers, more in the Andhra area, they constantly practice, even if he is fevers and other acute problems. We will refer the patient to allopathic side or emergency hospitals. The book reading persons having the good knowledge, they are constantly giving homeopathy medicine for their family members, especially sugar and other systemic disorders also. They won't take any medicine except homeopathy medicine. Some of the people I know, some of the teachers, lectures. Second case, when I was started in 1 year practice, one illiterate rickshaw puller, Mussalman patient came to the clinic with chronic psoriasis, offensive smell from the body, foul smell. I was busy in the clinic. I thought that I cannot treat this patient in the first instance. Simply I said, one of my friend is practicing Gandhi Hospital skin department. I referred that case to him. I gave chit. He took the chit, he did not go there. He went somewhere. After 3 months, he returned to my clinic. Doctor साहब उनका भाषा में मुसलमान पेशेंट और रिक्शा पुलर. डॉक्टर साहब आप अच्छा डॉक्टर अच्छा देखता बल्कि आपके पास आए तो मेरे देखे भी नहीं, टच करे भी नहीं, दवा दिए भी नहीं. मैं ये दवा इस्तेमाल करे इससे पूरा ठीक हो गए. उन्हें एक बॉटल ला के टेबल के ऊपर रखे. मेरे जैसे पेशेंट आए तो आप दूसरा जगह मत भेजो. You give this medicine. The name of the medicine was Kaskara Amaraga Q. He was totally relieved. When I saw the first instance, the body was chronic infective psoriasis with offensive smell. After 3 months, the body was totally clean. Patient was totally normal. Another case, initial stage, nearby Bonnier place. One child brought to me, aged about 8 to 10 years, infected dermatitis, otherwise impetigo, both legs. Based on that, I gave medicine to the patient, Meziran 200, calcareous alpha silicea 6x, followed by external calendula mother tincture and echinacea ointment. Second day, he returned to the clinic. Doctor साहब मेरे की दवा नको, दवा वापस ले, पैसा वापस दे दो. What happened? No साहब मैं तेलुगु में बोलते था. మా ఇంట్లో మా అమ్మ వాళ్ళు మా భార్య వాళ్ళు చెప్పినారు ఒక గోళీ లేదు ఒక సూది లేదు ఒక మందు లేదు ఎందుకు తెచ్చినవి మందులు పిల్లని చంపడానికి తెచ్చినవా They rejected, they don't want to give the medicine. I said, I don't take the medicine return, I won't give money to you. This is not emergency problem. This is not appendix, this is not heart problem. This is a simple skin problem. 100% that will be curable with my medicine. What are the medicine I have given? You take that medicine for 1 week, 10 days. If your child gets something, I don't want to practice, I close my clinic. I created a confidence and gave the medicine. After 1 week, 10 days, totally cured the impetigo, infected dermatitis. Patient was so happy. Another practical experience of what I exposed, what I learned from the patients, especially in chronic patients suffering with diabetic, insulin diabetic, suffering with rheumatic arthritis, rheumatoid arthritis, psoriasis, or lichen plus, whatever it may be. When patient is under steroid therapy, should not discontinue the medicine immediately. Don't withdraw the medicine immediately. You will get the bad propaganda from the patient. They will create a negative propaganda if you withdraw the medicine immediately. I got one experience. One RTC driver from the Yadagirigutta, his name is Ramulu. His daughter, 12 years aged, suffered from rheumatic arthritis. Prior to my clinic, patient was shown to two important doctors. One doctor, Deswanta Rao, he was no more, he is superintendent of Gandhi Hospital. Another doctor, Dayasagar, Andhra Pradesh Sabha cardiologist. Both the doctors seeing that child. In allopathic side, they are regularly giving Disperin tablet morning night, Visalon tablet morning night, Procan penicillin 6 lakhs every week. Patient was medications since 6 months prior to coming to my clinic. I said that don't withdraw the medicine, steroids immediately and painkillers also. I will give the medicine. After this course, you give the both and allopathy and homeopathy. After the getting of results, we can withdraw the medicine gradually like a tapering manner. What he said, my child was afraid and crying and weeping when giving injection, penicillin injection. When कल इंजेक्शन देना है तो पहले दिन से बुखार आ रहा है, पेशेंट बच्चे रो रहे हैं. Oh, I don't want that injection therapy. I want to take only your medicine. वो दवा लेने तो आपका दवा काय को वही दवा लेते वो दवा नहीं देते है. I will discontinue the medicine today itself. I convinced him, no, don't stop the medication immediately. Vaisalan. Patient when came to my clinic, patient came with a walking position. Immediately he took the medicine for 1 week, 10 days. He stopped the medication of Visalan, Disperin, and injection. After 10 days, patient was nude. The girl was not moving from bed. She was not walking. He brought with the auto, lifted from his hand. In clinic में बिठा के, when I brought my child in the first instance, she was able to walking. After आपका दवा के पास patient नहीं मूव walking नहीं कर रहे, आपका दवा से पूरा खराब हो गया बोल के पुकार रहे patient. Patient was giving some of the big hard words and crying. I said, I convinced you. Don't stop the medicine in the chronic problems. And other attendants also there in first instance. At last, he convinced and went to the clinic, went out from the clinic. What I want to tell is, in initial, especially junior doctors, patients come to the diabetic and hypertension, all systemic disorders. Don't withdraw the medicine. I don't want to comment, but even though some of the homeopathy doctors, they won't accept the allopathic treatment. Allopathy doctor won't accept the Ayurvedic treatment. Ayurvedic doctor won't accept the homeopathic treatment. Integrated also we can practice in certain cases. For example, patient comes with high fever, 103, 104. If we do homeopathy medicine, Belladonna, arsenic, arastak, whatever it may be, we immediately half an hour, 1 hour, patient will be at the phone करते घर जाके एक पैसा भी कम नहीं, 2 पैसा कम नहीं, ऐसा हो गया बोलता. Instant relief you can give allopathy medicine. What happened? Our medicines will improve the body immunity of the person. It reduces the secondary infection. It improves the body. It will give improvement in the resistance power in the body. Third, fourth case, that Gopal Krishnan, Durga Prasad sir also know. Balaji, one of the, Dr. Sudhakar is a homeopathy doctor, brother. He was suffered with pseudolipoma on the left nose of the dorsum of the left nose. Operated at Yashoda Hospital, Somajguda. His son-in-law also cardiothoracic surgeon, his daughter also anesthesia at Usmania Hospital, his wife also doctor, entire family were doctor in the family. After the operation of the pseudolipoma, the growth was again recurred. They suspected the malignancy and taken the biopsy, this and that. After डर के मेरे पास आया, I gave the medicine, 2 acid and dalcamera, with followed by lipoma drops, totally dissolved within 1 month. Since 1 year, he is not having any problem. Another patient, एक RTA, road accident, leads into spinal paraplegia. Patient admitted in Usmania Hospital. 3 months was there. Bowel and bladder was absent. Within the 3 months time, patient was given enema, then only passed. When I used to go to the Kepal orthopedic related hospital, I used to consult, I was going as a consultant there. We brought the patient admitted to the hospital. First day, based on our medical knowledge, I gave arnica 200. That medicine was not relieved, worked. I learned some of the medicine. Prior to that, I am lucky student having exposing to, or I attended all the clinics of the important doctors in homeopathic field. First year, I used to attend the Dr. Ramakrishna Reddy sub clinic, Chikadpalli. Third year, fourth year, I attended the Dr. Prashantan GLN Shastri clinic. Fourth year, I worked at Dr. Janardhan Reddy sub clinic. Also, then I worked at Dr. A.V. Ramana Rao. He is allopathy doctor practicing homeopathy medicine. In PG also, I worked at Dr. Son Singh sir. I learned some of the points, practical tips from these important stalwarts. Based on that, I will convince the patient, I will give right medicine to the patient. I gave arnica, not helped. Ramana Rao sir said that the synthetic medicine, paraffin 30. I gave the paraffin 30 repeated doses, followed by the medicated castor oil, followed by the honey, Vilax tablets and homeopathic constipation drops. Within 3 days, patient got the regular bowel movement. After 1 week or 10 days, within 1 month, in Usmania, orthopedic and neurosurgeon, everybody tried. They said that is spinal paraplegia. Its case will not be improved in future also. Patient was improved, he was walked without any help. Another important case regarding the, actually I am asked to speak piles and fissure. I will give 1 or 2 important patients what I faced the problem. For example, any official people comes to your clinic, especially IAS and IPS people, scientists, judges, they will not convince immediately. They will put number of questions to us. If they are having worth, we are able to give reasonable answers, they will convince and they will give positive propaganda to us. Recently, Gopalakrishnan might be knowing, Rajat Kumar recently retired IAS officer, very first or second position in the KSR government irrigation department. He is a very IIT student, very intelligent, recently retired from the service, collector. He worked as a sub-collector at Bongir. His entire family is to take medicine from me. One day he put a question, Doctor Sahab, मेरे ज़्यादा गुस्सा आता, कई को आता? I said, गुस्सा आना पड़ता साबन, कई को? In homeopathy, there is a principle in our Prashant sir used to tell. Good persons have certain qualities. What qualities? STDHII. Sensitivity, trustworthy, delicate, healthy, intelligent, irritability. Good persons will have these qualities. What is irritability? Immediate reaction to the environment situation, overreaction to the situation. Intelligent person have the irritability. I convinced in a way, sir, your administrator, especially some of the departments like police department, we in medical department, we will get the wanted people, especially in police department, they will get unwanted people, antisocial element, terrorist, thieves, goes to the police station. If doctors like us, if we go to there, they will give a chair and give some water and tea. If thief also go, if anti-terrorist or terrorist go, anti-social element goes to the police station. If they give Raja Maryada, will they reveal the problem? They have to use their own language. Like a माँ लोड़े क्या है बोल के डर के डराना पड़ता. उस वास्ते they should get irritation depend upon situation that requires from the certain professions. I explained him, police department vaisa rehta. You are the collector. Collector, everybody has to attend by 9 o'clock. One subordinate comes by 10 o'clock, another comes 11 o'clock, another comes 12 o'clock. Will you keep quiet? You have to give some punishment to show cause matter, something else. You have to irritate them. Then only the work will take. All administrators should be dictators. Dictator रहना पड़ता, गुस्सा आना पड़ता. But all the times गुस्सा should not be help you. సంగీతాన్ని సింతకాల రాలని తెలుగులో ఎప్పుడు నవ్వుకుంటూ మాట్లాడితే పనులు కావు. Depend upon situation, you have to react. You have to. I convinced him a lot. He was very much impressed. The entire family used to take medicine from me. నేను చెప్పాలని చెప్పొద్దు, గొప్పల కొరానికి అని కాదు, గోపాలకృష్ణ నాకు తెలుసు. నేను ప్రాక్టికల్గా కొన్ని చెప్తాను. హోమియోపతిక్ హాస్పిటల్స్ మన టీచింగ్ హాస్పిటల్స్ ఉన్నాయి మొత్తం స్టేట్లో. When Madhav Reddy was the health minister, we conducted a medical camp. That Dr. Janardhan Reddy, superintendent, and Damodar Reddy, Praveen sir, Rajendra Reddy, all came to the Bonnegiri. In that, that Rajat Kumar, why I am telling this, if you convince the important person, intelligent person, they will give positive propaganda to us. On the dash, he spoke, Raghupati is too intelligent, too intellectual, having such kind of person, Bonnegiri people are too lucky. Because of his homeopathic treatment, people got the good awareness, told to the health minister, Madhav Reddy sir. Immediately impressed, and all villagers, reporters said, Madhav Reddy sir opened 10-bedded hospital in homeopathic hospital, area hospital, Bonnegiri. Prior to our main entrance, our 10-bedded homeopathy hospital will be there, first phase, followed by allopathic hospital. That much priority gave to the homeopathic field, homeopathic in Bonnegiri. Why? Because, why I am saying this, elsewhere in the state, even combined Andhra Pradesh also, except to teaching college, only hospital will be there, all PHCs are there. Because of that Rajat Kumar, he was positive regarding the homeopathic treatment. He told to health minister, all reporters told to health minister, he opened, he sanctioned a 10-bedded hospital in Bonnegiri. That's why I'm revealing. Another important intelligent persons. When I was student of third year in Malakpet, Madhu might be knowing, Malakpet police hospital was there. Dr. Superintendent Dr. Vijay Kumar was there. I got some fever. I went to him. 1 or 2 visits I went to him. Second, third visit, he asked me, Doctor sir, what time you will be free? I want to discuss with regarding system of medicine. He was famous doctor. He was a big physician with having very good name in Nalgonda. Weekly 3 days, he was a superintendent. I was a student. That much personal. What can I discuss with him? He called me. I went to his clinic at police hospital. He put some of the questions. What is the difference between homeopathic and allopathic treatment? I explained the 3 parts, 1, 2, 3. Allopathy is a ready-made, if you want to stitch a dress. Ours is a tailor-made. Allopathy is a ready-made. If you want to purchase a dress from the shop, if you go to the lifestyle or some of the shopper stop, you will take the 30 numbers point, 40 number set. That ready immediately, within 5 minutes, you will get the dress. In as homeopathy, if you want to go for the tailor-made, we have to select a good shop, or Reliance or Gwalior. We have to select a senior tailor, go there. We have to give our measurements, neck measurement, waist measurement. After that, we will get the ready of the dress. That's why I am saying this. If we go for the ready-made dress, within 1 or 2 days, 1 month, immediately it will be, the stitches will be go. If you go for the stitched dress, that will be permanent. Homeopathy, allopathy में क्या रहता? आंख के एक डॉक्टर, हड्डी के एक डॉक्टर, पेट के एक डॉक्टर, पीठ के एक डॉक्टर, रोए तो डॉक्टर, आसे तो एक डॉक्टर, उठाने के एक डॉक्टर, लेटाने के एक डॉक्टर. అదే చెప్పాను ఆయన. కంటికో డాక్టర్, పంటికో డాక్టర్, చర్మానికో డాక్టర్, బొక్కలకో డాక్టర్, ఎయిడ్స్తో డాక్టర్, నవ్వుతో డాక్టర్ వంచుకుంటారు. Whereas in homeopathy, we will consider the system of bodies as a whole. We will consider generalization, we will consider a localized, organized wise. एक ब्रांच रहता झाड़ का, आम का झाड़, जाम का झाड़ रहता, उसको 10 ब्रांचेस है, 100 पत्ता है, फल है, उसको पोर करना, क्या करना, रूट्स के पास पानी डाले तो हर एक ब्रांच, हर एक लीव्स, it will be green. If you want to cut it, we have to cut the root level. अंग्रेजी में क्या रहता, एक एक ऑर्गन के एक सिस्टम रहता. वी विल कंसीडर द वुमन बॉडी एज होल. इफ यू गिव प्रॉपर ट्रीटमेंट टू द पेशेंट, automatically reveal and unreveal problems solved with medicine. One of the patients, one child brought to me with only, I was busy in the clinic having said that the bed waiting problem. I gave them medicine. Another problem was that they think that I will reveal the second visit. When second visit, the patient brought to me, both the problems solved. Bedwetting is cured and warts from the body also cured with caustic medicine. One of the patient came to the Kepal Bones Hospital having the fracture of the radius and ulna. I was giving medicine 3-4 months. After that, 3-4 months, everybody is moving from the clinic. The patient was not moving. He is illiterate. He doesn't know how to speak to the doctor. पैसा पूछ रहे साहब ने देन मंदल इస్తున్నావు बोल के पूछा है अरे వీటి ఇట్లా ఎందుకు కడుతున్నావు ఏమైంది మెడిసిన్ ఇచ్చినాక సార్ నేను 10 years నుంచి నాకు కాళ్ళకు ఆనలు ఉండే కోస్తుంటే ఆఫ్టర్ మెడిసిన్ నేను ఒక్కరోజు కూడా కట్ చేయలేదు మాకు ఆనలకి కాన్స్కి మంది ఇచ్చిరా అన్నాడు కాన్స్ అని వాడు చెప్పలేదు కాన్స్ కానీ నేను మంది ఇవ్వలేదు ఐ గివ్ మెడిసిన్ ఫర్ ది ఫ్యూజన్ ఆఫ్ ది బోన్ ద మెడిసిన్ ఇస్ ఇండికేటెడ్ సూటెడ్ హిస్ పర్సనాలిటీ కాన్స్ ఆల్సో డిజాల్వ్ వన్ ఆఫ్ ది ప్రిన్సిపల్ జేఎన్డి ది లోకల్ నర్సింగ్ అండ్ బోన్గిర్ diagnosed of the renal caliculated urinary tract infection. One urologist seen the case, not responded to fever and this again that he got the high temperature, tested, gave the report of typhoid. General patient seen. He is not taking any food. They've given some saline, developed cough. For the kidney, one doctor. General patient for the fever. Cough for the pulmonologist. 3 doctors treated with 1 or 2 months. After that, a patient brought to me. I gave a single medicine, arsenic, and followed by something else. Total problem solved that patient. Like that, I explained the homeopathic way. Whatever the number of problems will be suffered with patient, with single medicine, single doctor will be helpful the way of treatment. What I explained to Vijay Kumar sir, he was so much convinced. He said that so far I discussed with number of persons. You clarified my doubt. Sabash balke tarif kare. Regarding the piles and fissure, piles, fissure, fistula. The exact cause for another thing I want to tell some of the abbreviations. If you want to interest, if you remember it. For example, intellectual friend or any patient comes to you, clinic or आपके पास dinner के पास जाता है, in function you will get it. They will put, sir, me diabetes kaiku aata, sugar enduku vastani adugutadu. I will tell, ఒకటే వర్డ్లో చెప్పాలి, ఒకటే నిమిషంలో చెప్పాలి. షుగర్ ఎందుకు వస్తుందని అడుగుతాడు పేషెంట్, షుగర్ ఎందుకు వస్తుంది. I made an abbreviation, remember it if you want to remember it. Etiology, clinical symptom, complications. Etiology, పుస్తకంలో exact cause is idiopathic cause is not clear to medical science. Some of the predisposing, OPPA, you remember the name of OPPA. H for hereditary, O for obesity, P for pancreas, another for pituitary, another for adrenal. These are etiological factors for getting up the diabetes. What are the problems? Biological rhythm, 2 inputs, 2 outputs. All P's, polyphasia, polydipsia, polyuria, perspiration, prostration. These are problems. दवा नहीं लिया तो क्या होता? All pathies. क्या पथी होता? Myopathy, retinopathy, neuropathy, nephropathy. This is within 1 minute you can explain the diabetic problem to any person with future. Piles kaiku aata, HCOP, hereditary, constipation, obesity, pregnancy. Ulcer kaiku aata, hurry current leads to acidity followed by ulcer. पेशाब में खून जा रहा है, kaiku जा रहा है, क्या बोलते हैं? You remember one code, CITNO, circulatory, infection, traumatic, neoplastic, other causes, circulatory, polycystic kidney. Sir, congenital, polycystic kidney, infection, glomerulonephritis, pyelonephritis, CIT, traumatic, any injury to the kidney urethra, neoplastic, any tumors, malignant tumors, other causes, hemophilia, purpura. These are the causes for hematuria. Patient comes with a prostate problem. Prostate kaiku aata, prostate type kaise malum hota? You remember one name, F Buddha. F for frequency, P for burning, U for urging, D for dribbling, D for dysuria, H for hematuria, A for anuria. These are symptoms of the prostatic hypertrophy. Like that, for example, tumor is there. Patient asks, ये benign कुछ नुकसान होता अच्छा रहता है, कैसे मालूम होना, डरता पेशेंट. Whether it is benign or malignant, how will say? There is a code. You remember the name, RLF Imran, whether a benign tumor or malignant tumor. These are the difference. R means rapid growth, loss of polarity, fatal outcome, invasion, metastasis, recurrence, and plastic changes. This is a malignant feature. That is the benign features. Like that, if any intellectual patient comes, especially scientists, doctors, all people, they will put a questions. If you are reasonable, if you're in a position to give a reasonable answers, they will convince, they will tell to some other patient. Like that, there is an abbreviation. If you, when we studied in the college life, our seniors, some of the, I remember Dr. M. N. Chari and Dr. Bharath, they are very intelligent people. We used to take some of the, for example, we will routinely use the allergy. What is allergy? What is immunity? Not a biading. If you remember analytic way, the Bharath told me, what is immunity? The ability of the body to recognize, to destroy, eliminate the substance which is foreign to it. That's called resistance immunity. ఉత్త బయాడ్ కన్నా ఎబిలిటీ, బాడీకి శక్తి ఉండాలి, ఎబిలిటీ ద బాడీ రికగ్నైజ్, గుర్తుపట్టాలి, డిస్ట్రాయ్ సంపాలి, ఎక్స్పెల్ అవుట్ సైడ్ పంపించాలి. దట్ ఇస్ కాల్డ్ ఇమ్యూనిటీ. వాట్ ఇస్ ఎలర్జీ? ఇట్ ఇస్ అన్ అబ్నార్మల్ రియాక్షన్ ఆఫ్ ద లివింగ్ బాడీ టు ద స్టిమ్యులై విచ్ ఇస్ నార్మల్ టు అదర్స్. అందరికి పడి మనకు పడితే ఎలర్జీ అంటాం. ఇట్ కెన్ బి ఎక్స్టర్నల్, ఇంటర్నల్. వన్ పర్సన్ నీ ఫ్రెండే అడుగుతాడు, నేను మంచిగా ఉన్నానా, బీమార్ ఉందా, సెల్ ఐ గో ఫర్ టెస్ట్, సెల్ ఐ గో ఫర్ హాస్పిటల్, నేను ఇంట్లో మంచిగా ఉన్నా అంటాడు. హౌ కెన్ ఈ సే? మీరు ఎట్లా చెప్తారు మీరు ఒక పర్సన్ మంచిగా ఉండా లేడా? హౌ కెన్ ఈ సే? డాక్టర్ ప్రసాద్ సార్ చెప్పాడు మాకు చదువుకుంటూ, బయాలజికల్ రిథమ్ అంటాం. వాట్ ఈస్ బయాలజికల్ రిథమ్? 2 ఇన్పుట్స్, 2 అవుట్పుట్స్. గుడ్ ఎపటైట్, ఆకలి, దాహం, మలం, మూత్రం, నిద్ర మంచిగా ఉండి, జ్వరం లేకుంటే ఆరోగ్య లక్షణం. ఒకటే సింగిల్ వాళ్ళ చెప్పాలి, కడుపు నిండా తిండి, కంటి నిండా నిద్ర ఉంటే ఆరోగ్య లక్షణం, అది లేకుంటే బీమారి, పరీక్షలు పోవాలి. అదనమాట. ఇక్కడ ఏంది పైల్స్ ఫిషర్ ఫిస్టులా గురించి. వాట్ ఈస్ పైల్? ఎల్లాక చెప్పాను, పైల్స్ ఫిషర్ ఫిస్టులాకు కాజెస్ ఏం లేదు. ఇడియోపతిక్ ఎటలాజికల్ ఫ్యాక్ట్ కాజ్ ఇస్ నాట్ క్లియర్ ఉంటుంది మెడికల్ సైన్స్. సమ్ ఆఫ్ ద ప్రీడిస్పోజింగ్ ఫ్యాక్టర్స్ అది హెచ్సిఓపి, hereditary constipation, obesity, pregnancy. Piles is protrudered swollen rectal veins are called piles. In that, internal and external piles. In fissure, the crack or ulcer, elongated ulcer, rectal area, having some of the severe pain and tenesmus. Fistula is a tract lined by granulation tissue having opening in the rectal. These are the differentiating points. Why I will tell one case of the piles and fissure. One of the important police officer suffered with piles with the fissure problem. He went to different doctors. Prior to his own brother also doctor, Armour, Jagdishwar Reddy. He was diagnosed as a piles posterior anal fissure first degree hemorrhoid. He was, prior to my treatment, he was shown by different doctors. 2 gastroenterology doctors, 4 surgeons, 4 MBBS doctors. With 3 months they treated, not getting the result, not having any pain relieving. After that, they called me and I went to police station, the circle office. I gave a medicine. First, prior to that medicine, I seen all reports. One was written, this requires surgery, another was on medical treatment, one is first degree, second, third degree. All degrees and all proctoscopy, colonoscopy, rectoscopy, all the scopes are done. And last, I put a, time is over. Venu, time is over. I simple like I seen all the reports. Patient was in Telugu literally saying that, sir, my father like that when I want to go to the stool, the morning the total basin was filled with blood. My father was died with rectal cancer. I'm afraid whether I'm getting cancer. The total bleeding since 3 months, the bleeding was not stopped. All the doctors, one is operating, one is advised operating, one is medical treatment. I'm suffering. सुबह motion जाना मतलब रात में वैसा fire तड़प रहे. I am not getting good proper sleep. What he was cried was officer, police officer. Simple, I asked him, what diet you are giving, what diet he is giving. Mrs. ने family हैदराबाद में मुस्लिम कांस्टेबल है, क्या दे रहे हैं बोले तो क्या दे रहे सर, रोज चपात डाल के आमलेट दे रहे हैं बोले, चपात दे के आमलेट दे रहे. Most of the doctors are not patients. They will not have bother about the diet and management. Everybody is putting the proctoscopy, colonoscopy, sigmoidoscopy sent to the patient to the bone. He was crying and weeping, crying, weeping. Simply what I did logic there, आपको जो प्रॉब्लम है, जो द वीट खा रहे चपाती ऑमलेट प्रॉब्लम ज्यादा करता, ये फायर में नमक डाले तो डीजल पेट्रोल डाले तो फायर ज्यादा होता कम होता, ज्यादा होता है ना, अब पानी डाले तो कम हो जाता। आप उसमें बड़ा कर रहे प्रॉब्लम को। मुसलमान कांस्टेबल बोले कई को दे रहे चपाती, साहब बोले साहब चपाती दे ऑमलेट दे, बोले अरे वो रोक दे भाई, रोक दे के क्या देना, इडली दे दो। इमीडिएटली कांस्टेबल बेके इडली लाए, बताए ले लो, honey ले लो। I changed the entire diet, gave them everything medicine, acid net, hemagglutinin cube, 5 syrup, Helenka, R13 drops. Within hours, the total bleeding and problem stopped. Believe me or not, I treated that case 30 years back. Entire police officer, including present DSP, every DSP used to take medicine from my clinic. All are my friends and patients because of treated that case. Another severe bleeding pulse case, one businessman from the Vaishya community, Bongir, he came to my clinic with a lungi, as if the menstrual bleeding comes from the lady's side. Total, the lungi was wetted with blood. He was sitting, when we seated in the clinic and chair, completely the chair was in a blood condition. Blood was oozing. I gave a medicine, immediately amylis cube, followed by the myrifolium phosphorus. Within 2 days, the total bleeding was stopped. Another patient, fistula patient, Santosh nearby Naratpalli. She was prior to my treatment, she was undergone 3 times operation at Common Hospital once, Nalgonda Hospital one, Global Aware Hospital. 3-4 lakhs spent for operations. The oozing was coming, the secondary is not reduced, or they give septum, antibiotics, saffron, whatever. They are not reducing. After I gave the medicine, Merxal, Eparsab, Silesia, cyclical medicine, followed by gunpowder, calendula Q, igneous ointment. Totally, within 2-3 months, the total fistula was not recurring again. Since 2 years, patient was so much comfort. She is bringing number of patients. I want to put some of the juniors or the students in the air. When I was first year, the Sivasankar sir, our principal and additional director. When I was a student of first year, I put a question to any student who want to give answer. What is the difference between medicine, drug, medicine, remedy? Anybody? What is drug? What is medicine? What is remedy? Anybody can tell? What is drug? One says, I'm giving drug, this drug. Another case, I'm giving this medicine. Another case, I'm giving this remedy. What is the difference? Single word. Anybody can tell? Sivasankar Sahib said, the medical substance before preparing is called drug. After preparing the drug is called a medicine. Indicated medicine is called remedy. That was remembered in my student of first year. Some of the patients, even one of the pediatric patient nearby my house, a child incidentally while playing swallowed the 2 rupees coin. That was obstructed in the small intestines. They have taken X-ray and scanning. They plan to remove with endoscope method. I studied somewhere the expulsion of the foreign bodies from the body. I gave Silesia 200. Totally that was cured. Another hiccups, they homeopathic dawa late karta, result nahi rehta bol. One of the ME 2 or 3%, they developed severe hiccups. Kaise one famous Dr. Surendra, they have given anti-digensil, reflex syrup, or whatever, Gentag, whatever the allopathy said. 1 week, 10 days suffered the patient. Avita started, I inquired, Avita started. When I went to village, I took some toddy. After that, I developed. I gave immediate Naxuamka 200 followed by ginseng cube. Within 1 minute, the total hiccups were stopped. Even when I was a student, I treated a number of cases of scorpion bites, even fracture cases, even constipation, absolute constipation. When I was in Ramna Rosa clinic, one child was not in a position to not pass the stool 1 week or 10 days. He gave a paraffin 30 regular doses. Child was getting regular motions. I even ganglion also, some of Ruta, very good medicine. If you want to practice, there is some coding. Whether one already I revealed, one is practicing in own way. Even I attended the clinics of Dr. G.L. and Shastri. He was giving only single dose. Even Prashant sir single dose. My uncle Janardhan Reddy sir give one medicine. Ramana Rao sir gives another medicine. I got, Dr. Son Singh sir gives mother teacher mixed medicine. He gets result. Even all our places of what I say, and even depend of situation, I will give the medicine. One skin problem will come, only I will give single dose. When I'm one of the friends asked regarding the kidney stones. In where I am practicing Bongir and Nalgonda district is totally hard water and fluoride water. We are getting number of patients from the kidney stones. We will see in Bongir and Tarnaka nearly 50, 60 patients. Among that 60, 20 patients will be kidney patients. I am having the name of the kidney specialist, urologist doctor there. Patient comes with severe problem. They undergone the treatment of the antibiotics and injections or other therapy. They will not get relief. If they comes severe vomitings, I give arsenic 1 ml, followed by pain and McPus collagen, followed by berries drops. If they get vomitings, I will give Baxan B63 drops. Any patient of, you remember, write I'm giving challenging to you youngers and juniors if you want to confidence on homeopathic treatment. Any patient of piles with fissure, you give piloip syrup or 13 drops. What are the medicine you want to give? Another sulfaracinate, Naxwam, Camersal. R13. Practice when I was student first year itself, 83. All the scorpion bite, snake bite patient used to come, all acute fevers comes to clinic. When patient comes to clinic, we have to give confidence. For example, in Hyderabad, what type of practice, they want to go to the homeopathic field. Who is a senior doctor? Dr. Gopal sir, Venkat Sam sir, senior, Durga Prasad sir, Venugopal, they will put the name and they will go to the homeopathy doctors. In a town, the treatment will be not like that. They will compare allopathy doctor to homeopathy doctor. If the child got the fever, they went to pediatric doctor. Then the patient will not get relief. They come to our clinic. We have to give challenging to immediate giving of result to the acute cases. 1 or 2 or 3 times, Janardhan Reddy Saab asked me, why Raghupati, why you are giving assurance with this will cured within 1 month, this cured 2 months, 3 months, 1 day. Why are unnecessary giving that challenging? One patient came to me with warts. कितना दिन टाइम लगता? 3 महीने. 3 महीने में कम नहीं हो तो कैसे? I close my clinic. You give the any newcomers who's a acinate first Silicea calcarea dulcamera. 80 to 90% of viral warts will be solved by these medicines. If you want Requeg RE88 drops, RE88, remember and write. 100% warts will be solved by the 30 to 50 millimeters. Go to CM potencies also. Dr. Ramana Rao, I experienced there. Silicea calcarea dulcamera, most of the cases will be cured by the warts. Or some of the anti-crude acid or something. Even corns also. Ranunculus bulba, anti-crude Silicea. These are very good medicines, practically speaking. Even I treated a number of patients of fracture in the Kepal Bones Hospital. One patient was multiple fractures underwent with a lorry accident. He was treated at Gandhi Hospital 4-5 months. After that, all the POP is done. He when brought to the Kepal Hospital, when we opened the bandage, 300 to 300 or 400 worms came from the POP bandage. So much offensive smell from the patient. Every patient was run from the hospital. In that case, we put it in the hospital, treated with the homeopathy medicine, calendula mother tincture, igneous ointment, gunpowder. You remember any injuries, any septic condition, give the gunpowder, very good medicine. Gunpowder with followed by the Merxa, leprosal, silicea for infections and wounds. For painkillers, arnica, Belisper ruta, Brian Rustax. Another giant problem is even I explained a number of patients if you want to write the medicines. Even Kadarwali is there, non scientist, no? He researched on the homeopathy medicine, no? Great man. He is any osteoarthritis condition. He has given some formula like arnica 6, Briana 6, Calcaroflex 6, Ledampal, Ruta, Rustax. If combination gives 100% osteoarthritis patient with especially required dilutions. Even my close family members suffered with osteoarthritis, grade 3, grade 4, advised operation. Avoided the operation giving a dead medicine. If you want osteoarthritis patient to give the R73 drops, required drops simultaneously with these medicines, patient will immediately get the result. If you want any acute problems, we will give the infrared light, like arnica spray or Rustax spray. Any patient comes with severe neck pain, patient has to get immediate relief spontaneously. If especially chronic disorders, thyroid problem, hair falling, white patches, what we call leukoderma, these are patient will not that much hurry. When acute cases comes with piles fissure, comes with high temperature, comes with renal calculi, comes with severe headache, we have to treat within the clinic itself. If we give some of the medicine, they will go to the house within half an hour, thoda bhi parak nahi pada, angama karta, patient they will blame and they give negative report towards us. We have to give instant medicine for the depend upon situation. We have to give polypharmacy also, number of doses. In kidney condition, we will put the patient within 5 minutes, we will change the medicine, arsenic, macroscopic, and cancer like that. Even scorpion bite, I treat a number of cases of scorpion bite. Like any patient gets vomiting, so give used to arsenic. Any patient have the cold and clammy perspective, give ledampal and carbase. Any patient have the severe radiating pill and burning sting, epismel 200 sting cure drops. Like that, in rural area exposed, I did lot of work on this. I was a student, first year to final year. When I started 83, because of some senior doctors like Dr. M. N. Chari, Dr. Durga Prasad, a batchmate, Dr. Birappa, those were my seniors in the hostel. We used to take help from that. Even I attended the clinics from Dr. Ramakrishna Reddy sir and other people from first year itself. We used to brought the patient to clinics. Like that, I got some of the experience. Anybody wants any help from me, you take my number at any time. Generally, homeopathy మేము చదువుకుంటప్పుడు చెప్పకూడదు కానీ హోమియోపతిలో ఒక డిసడ్వాంటేజ్ ఏంటంటే తెలియనోనికం తెలియదు, తెలిసినోడు వేరే వాళ్ళకి చెప్పాడు. సిస్టమ్ ఎట్లా డెవలప్ అవుతుంది? ఇప్పుడు కొంతమంది డాక్టర్లు ఉంటారు, వాళ్ళకే తెలుసు, వాళ్ళే సూపర్ పండితులు, వేరే వాళ్ళకి చెప్పారు. చెప్పండి నేను మురిగిపోతుంది కదా. వాట్ ఈస్ యూజ్ ఆఫ్ హ్యావింగ్ నాలెడ్జ్? వీ హ్యావ్ టు గివ్ నాలెడ్జ్ టు ది యంగర్ జనరేషన్, నెక్స్ట్ జనరేషన్. సిస్టమ్ విల్ డెవలప్. సిస్టమ్ డెవలప్ అయితే అందరు రెస్పెక్ట్ ఉంటుంది. వచ్చిన ఒక ఆయన చచ్చిపోయి ఏంలో వాట్ యూస్? అట్లే ఇఫ్ వి ఆర్ హ్యావింగ్ నాలెడ్జ్. చిన్నప్పుడు చదువుకున్నాం, ధనం గొప్పదా, విద్య గొప్పదా, కలం గొప్పదా, కత్తి గొప్పదా? ధనం తరుగుతుంది, విద్య తరగదు. కులపతి. అందుకే మేము చెప్తే గొప్పలనిపిస్తుంది. మేము ఎప్పుడు చదవటం కాదు, సీనియర్గా దుర్గాప్రసాద్ వీళ్ళతో నేర్చుకుని జూనియర్లకు చెప్పేది, సీనియర్గా నేర్చుకుని జూనియర్ చెప్పేది. ఫస్ట్ ఇయర్ నుంచి ఫైనల్ దాకా నేనే కాలేజ్ ఫస్ట్ స్టూడెంట్లు. ఎప్పుడు పద్యాలా చెప్పేది. సార్ ప్రశాంత్ సార్ ఉండే, మేము వైభాగ్ పోయినప్పుడు కర్ణాటక లెక్చర్ వచ్చి, ఎనీ ఛాన్స్, వాట్ ఛాన్స్ యూ నీడ్ ఫ్రమ్, ఐ డోంట్ వాంట్ ఎనీ ఛాన్స్ ఫ్రమ్ యూ అని. He put what is susceptibility, what is immunity, what is allergy. Why I don't reveal? Prior to his question, I gave answer. Prashant sir said that since my 15-20 years ago, nobody, I didn't see such kind of student in the homeopathy field. The KJK Shastri, when I was in final year student, my external Viva person came. He is a computer of homeopathy, you ask whatever you want. That in Dr. A.V. Ramanarao, when I used to attend his clinic, and in the Brahman, very good knowledge. Is master. He gives single dose also, multiple dose also, repatriation also. He treat a number of cases. He won't bother a CM or BM, you don't designation. My timings are 9 to 11 only. You might be PM or CM, you don't bother about designation. He's a strict person. He used to practice homeopathy. Now also he's practicing, his son also, allopathy MD doctor, he's practicing homeopathy himself. He gives so much confidence. I used to attend his clinic. He said that if you stick on to homeopathy practice, he will become topmost master state. What he revealed? చాలా చెప్పాడు నాకు అట్లా. అందుకే నేను వాట్ ఐ వాంట్ టెల్ ఇస్, మీరంతా సీనియర్ దగ్గర నేర్చుకోండి, జూనియర్లకు చెప్పండి. తెలియని విషయం నేను ముందు నుంచి నేర్చుకున్న సూత్రాలు ఒకటి తెలుగులో. తెలియని విషయం తెలుసుకోవాలి, తెలిసిన తనకు చెప్పాలి. అది మనకు సబ్జెక్ట్ ఇంప్రూవ్ అవుతుంది. నేను చదువుకుంటప్పుడు అదే. ఇప్పుడు ఎవరైనా పేషెంట్ వచ్చిన ఇమ్యూనిటీ ఎలర్జీ, पेशेंट साहब मेरा बीमारी కైకు కమ్ नहीं हो रही, ఆ समय పేషెంట్ స్కిన్ ప్రాబ్లమ్స్ వస్తాడు, గౌరీ నాకు ఎందుకు తగ్గుతలేదు అంటాడు. నేను ఐ విల్ గివ్ ఎగ్జాంపుల్. when you want to construct a building, certain wood will be there. One A, B, C, D. A was constructed with teak wood, another tummakatte, C was vepakatte, D puntikattable. Different types of wood will be there. Carpentry is same, making charges the same. Teak katte 10 ఏళ్ళు, tummakatte అయిన వేపకట్ట పుంటికట్ట 6 నెలలకే ఇడిపోయింది. ఇక్కడ ఏంటిది, బాడీలో ఇమ్యూనిటీ లేని పర్సన్స్కు ప్రాబ్లం తొందరగా తగ్గదు, ఇమ్యూనిటీ తొందర తగ్గుతుంది. మరి వాట్ ఇస్ ద యూజ్ ఆఫ్ టేకింగ్ మెడిసిన్స్? వీఆర్ చేంజింగ్ ద బాడీ ఇమ్యూనిటీ ఫ్రమ్ లోయర్ లెవెల్ టు హైయర్ లెవెల్. ఇప్పుడు ఊకే జలుబు ఎందుకు వస్తుంది, ఊకే వాంతులు ఎందుకు అవుతుంది, ఊకే జ్వరం ఎందుకు వస్తుంది? నీకు బాడీలో ఇమ్యూనిటీ లేదు, రెసిస్టెన్స్ పవర్ ఉంది. మేము అదే కామన్ మనకి పేషెంట్ కన్విన్స్ చేస్తాం. అన్న అంటాడు అమెరికా పోతాడు, తమ్ముడు దుబాయ్ పోతాడు. అమెరికా పోతాడు సాఫ్ట్వేర్ కాబట్టి డబ్బులు ఉండిపోతే ఈ కన్స్ట్రక్టెడ్ బిత్తింగ్ టేక్ వుడ్. తమ్ముడు దుబాయ్ పోతాడు, దుబాయ్ పోతేనే లేబర్ పాపను పోతాడు కాబట్టి నా ఆచారంలో మనం ప్లైవుడ్ తీసుకుని పోతుంది. దానికి 5,000 అయితే దీనికి 50 రూపాయలు 100 రూపాయలు ఉన్నాయి. టేక్ వుడ్ కట్టిపోయినట్టు 10 ఏళ్ళకి రిటర్న్ వస్తే ఎండాకాలం వానాకాలం చేంజ్ అయినా దట్ డోర్ విల్ నాట్ బి చేంజ్ యాజ్ ఇట్ ఈస్, మంచిగా ఉంది. తమ్ముడు దుబాయ్కి పోతాడు, దుబాయ్లో కూర్చొని దేవుడా దేవుడా డోర్ మంచిగా కొబ్బరికాయలు కొట్టి ఉదిబత్తులు మంచిగా ఉంటుందా? నీ బాడీలో రెసిస్టెన్స్ లేనిది డాక్టర్లో తప్పేముంది? ముఖం బాగాలేక అద్దం బాగా కొట్టుకున్నట్టు అంతే కదా. నీ బాడీలో గట్టితనం లేదు, డాక్టర్ తగ్గలేదు, తిరుగుతారు మన దగ్గరికి. పేషెంట్ కమ్స్ విత్ ఏ హోమియోపతిక్ ట్రీట్మెంట్ ఆఫ్టర్ ఎగ్జాస్షన్ ఆఫ్ ఈచ్ అండ్ ఎవరీ మెడిసిన్, అలోపతి, ఆయుర్వేదిక, హోమియోపతి, మంత్ర, తంత్ర, all completed, comes to our clinic, they will blame from second day itself. First instance I will take the class to the patient. This is a chronic problem, you took a lot of medicine from this, all incurable stage తీసుకొచ్చావు. ఇప్పుడు ఏం చేస్తాం మరి? వాట్ ఇస్ ద యూజ్ ఆఫ్ టేకింగ్ యువర్ మెడిసిన్ అంటే ఉన్నదాన్ని పెరగకుండా చేస్తాం. వీఆర్ చేంజింగ్ ద బాడీ ఫ్రమ్ లోయర్ లెవెల్ టు హైయర్ లెవెల్. It will take some time, then we will convince the giving patient. They will not give any negative comment and when sitting outside the clinic. అందుకే ఇక్కడ మీరు తెలుసుకోవాల్సింది ఏంటంటే హోమియోపతిలో మంచి మెడిసిన్స్ ఉన్నాయి. డాక్టర్ ఇప్పుడు హోమియోపతి సిస్టమ్ ఆఫ్ మెడిసిన్, ఇట్ ఇస్ ఏ సిస్టమ్ ఆఫ్ మెడిసిన్ ఫ్రమ్ కామన్ కోల్డ్ టు క్యాన్సర్. We can treat cold, we can treat cancer also. Doctor is perfect, intelligent, alert. If you do not have proper knowledge and experience, we cannot treat even common cold, we cannot treat a cancer. C to C. కాబట్టి మన డాక్టర్ దగ్గర వర్త్ ఉంటే ఏదైనా బాగా చేయొచ్చు. మీరు ఇది ఓసే సముద్రం లాంటిది. మీరు రోజు నిత్య విద్యార్థులుగా నేర్చుకుంటే యూ విల్ గెట్ ద నెంబర్ ఆఫ్ థింగ్స్ ఫ్రమ్ ది సీనియర్ డాక్టర్స్. వీళ్ళంతా సెమినార్స్ అయితే అటెండ్ అయ్యి మంచి డాక్టర్ దగ్గర పోండి. థ్యాంక్ యూ ఫర్ గివింగ్ మీ ఆపర్చునిటీ టు స్పీక్. నాకు జనరల్గా నాకు 3 భాషలు ఇష్టము, నాకు 3 సిస్టాలు ఇష్టం. నాకు ఇంకోటి మీరు చెప్పకూడదు కానీ ఐఎమ్ హ్యావింగ్ నాలెడ్జ్ ఇంటిగ్రేటెడ్ సిస్టమ్ ఆఫ్ మెడిసిన్ ఆల్సో. మా గోపాలకృష్ణ తెలుసు, మా చుట్టాలంతా అలోపతి డాక్టర్లు ఉన్నారు, 2 బిడ్డలు కూడా డాక్టర్లు. మేము కేపాలకాడ పోయినప్పుడు ఎందుకు చెప్తున్నానంటే చాలామంది మిస్గైడ్ చేస్తారు. మీరేమన్నా అనుకోండి, నేను చెప్పదలుచుకొని చెప్తా. నేను ఇంటిగ్రేటెడ్ మెడిసిన్ వాడాలి. ఎందుకు అంటే అలోపతి డాక్టర్ హోమియోపతి వద్దంటాడు, హోమియోపతి డాక్టర్ అలోపతి వద్దు, అలోపతి డాక్టర్ ఆయుర్వేదిక్ వద్దంటాడు. 3 కలిసి కూడా ఇవ్వచ్చు. వై రిక్వైర్స్? నా దగ్గర పేషెంట్ రంగయ్య కేమ్స్ ఫ్రమ్ నల్గొండ. షుగరు, బీపీ, థైరాయిడ్, పైల్స్, ఫిషరు, కిడ్నీ స్టోన్స్, ఆస్తమా, పెరాలసిస్, ఆల్ విటిలిగో లైక్ యశోద, కామినేని, ఆల్ ఇంత ఫైల్ ఉన్నాయి. వాట్ మెడిసిన్ యూ విల్ గివ్? షుగర్, బీపీకి let them continue medicine. For acute problem, what are the piles or fissure, what are the kidney stone from present couplet, you have to give the medicine. What is the wrong? वो एलोपैथी होम्योपैथी डॉक्टर वो पूरा बंद कर देता है और ब्लेम చేస్తారు. होम्योपैथी की दवाई तो ज़्यादा हो गया. और recently నేను తార్నాక్ క్లినిక్లో patient was insulin dependent on insulin, patient was taking insulin. First he came to my clinic, सर मैं इंसुलिन रोक करता हूँ, इंजेक्शन देने को डर लग रहा है, इंजेक्शन दर्द हो रहा है. यार नक्को बंद करो बाबू, नक्का बंद करें. When patient came to my clinic, the fasting blood sugar was 160, post lunch was 240. He stopped the medication. He gave some of CGM mother tincture followed by homeopathic diabetic drops, all and medical homeopathic. After 1 month, the sugar shooted. Fasting 300, post lunch 500. Your medicines ज़्यादा हो गया, Johnson ज़्यादा रहे. Don't discontinue the medicine. You take the insulin. You take our medicine also. After some of the months, you have to gradually withdraw the insulin dose. That I convinced I presently is taking treatment from me. Thank you, one and all, for giving me the opportunity. Thank you.
Thank you so much, sir, for your elaborative explanation about the topic. I guess sir deserves another round of applause. Please give a big round of applause for sir. Thank you for your presence, sir. Now I would like to call upon Dr. Harshita Vure ma'am onto the dais to present about our second speaker, Dr. Boini Kavya ma'am. Welcome her with a big round of applause.
Dr. Boini Kavya graduated from Dev's Homeopathic Medical College, Kisara, and she completed MD from JSPS Government Homeopathic Medical College. She has been practicing since 2018. She is currently working as assistant professor in pharmacy department in Hamsa Homeopathic Medical College. She has published 31 articles in different peer-reviewed journals. From July 2025, she is working as a review member for Internal Journal of Advanced Research IJAR and Journal of Emerging Technologies and Innovative Research JETIR. Thank you. Let's welcome ma'am with a round of applause.
Thank you, Dr. Harshita. Good evening, everyone. It is my profound honor to stand before you all today to discuss a topic which plays a major role to our understanding and progression in the field of homeopathy. In the world where the modern medicine often fragments the human body into the isolated organs and chemical reactions, our homeopathic system of medicine stands as a beacon for restorative wholeness. I request Dr. Chamundeshwari to please give me a pointer. So all this was possible only because of our master, Dr. Christian Frederick Samuel Hahnemann, who has given this wonderful system of medicine to cure the sick to health, as it is termed. Next slide, please. So to achieve this, we need to have the knowledge of disease, knowledge of remedial powers, and knowledge of their employment, which is helpful for appropriate selection of simlimum. Next slide, please. So let's just dive into the concept. So while Hahnemann in his last years before his death was practicing in Paris, he was dealing with many number of patients with nervous disorders. During that time, he observed that there were unnecessary aggravations even if the medicine was given in the low potencies, as he was following the principles according to Organon 5th edition. So he realized that one of the important principle of homeopathy, rapid, gentle, permanent cure, was not happening up to the mark with the centesimal potencies. He was not satisfied with the centesimal potencies because the potencies were not acting rapidly. Next slide, please. And the time and frequency of medicines was not knowing correctly, and the period of cure took a large time, which added to his great dissatisfaction. And while treating certain weak sensitive constitutions with chronic miasmatic diseases, he noticed that either the medicine, if given in higher potency or lower potency, were causing unnecessary aggravations. So all this has led him to do the revision of his 5th edition of Organon by making necessary changes. So this led to the process of minimizing the material quantity of the drug by giving 100 succussions and reducing the material quantity 50,000 times with the drug strength of 1 by 50,000. And that's when we got the 50 millisimal potencies, which Hahnemann introduced in 6th edition of Organon. This was introduced mainly to avoid the unnecessary medicinal aggravation and to able to speed up the process of cure. Next, please. Next slide, please. Next, please. Yeah. So this LM potency, Hahnemann called as medicaments are globule. It was developed in 1838, 5 years before the death of Hahnemann. But as the sixth edition was posthumously published, not many of the practitioners know about it. So these are prepared with greater dilution at each step 50,000 times by giving 100 succussions. So my presentation will be very precise and it will be like a revision. What Hahnemann has already given in a Bible of homeopathy or Bhagavad Gita of homeopathy called as Organon of Medicine. So we have many advantages of 50 millisiemens potencies. Comparatively to the other potencies, we don't have any fear of severe aggravation of the disease or the patient condition, whether we give it in low potency or higher potency and in repeated doses. And this can be repeated any time and every time, whenever there is a need of medicine. And yet this 50 millisiemens potency has highest development of the power. They act very milder in reaction. So can be administered safely in the fatal cases without any fear of violent medicinal aggravations. So they also equally can be repeated in the acute cases with progressive benefits. And especially in treating some hypersensitive people, this is the best scale to be thought of. Then for treating the chronic diseases, severe pathologies and miasms, this can be thought of, and the frequent repetition is possible even for the long-acting remedies. Without any fear, we can repeat the long-acting remedies also for a longer intervals or at longer period of time. Then also the course of treatment can be minimized to half or even less when compared to that of centesimal potencies. We have many benefits of 50 millisiemens. Adding to that, especially in the mental illnesses also, where in some cases, when we give the centesimal potency, we will see the unnecessary aggravation. That can be avoided with the 50 millisiemens scale and can be controlled smoothly. And in cases of primary stages of this miasms, SORA, psychosis, and syphilis, where our master Hahnemann has focused on the repeated administration without any fear of aggravation, this scale proves to be very helpful and efficacious. So what happens generally in practice, we give the centesimal potencies. We normally have to wait for a few weeks to see whether the remedy selected is acting correctly or not. So this can be, time period can be cut short with the LM scale. We can see within 2 to 4 days whether the remedy which we selected has acted correctly or not. I'm not saying this is not the same with the centesimal, but the period of analysis will be helpful within a short duration of time, within 2 to 4 days. Then for treating the long time suppressed cases also, this potency works very effectively. And we already discussed, because the material quantity is decreased 50,000 times for each degree of dynamization, the power is developed in its full extent and it acts very deeply and yet milder in action. So whenever you have the stubborn cases which do not respond to any scale, think of the 50 millisiemens scale. My journey with 50 millisiemens scale started since my PG dissertation. My topic was utility of this Hahnemannian potencies in day-to-day clinical practice. And whenever I had standstill cases while curing the centesimal potencies, I always thought of 50 millisiemens potencies and It helped me very much. So let's just get into the numbers. Numbers, principles, aphorisms, whatever you believe. The idea of knowing these numbers is to get the right information and to understand very deeply. So Hahnemann has first spoke about this 50 millisimal scale in aphorism 246 footnote. So before the introduction of this 50 millisimal into sixth edition, he has done 18 months of work. Then he has written a letter to one of the publisher that after 18 months, am I audible? Sorry. Okay. So after 18 months, he has written a letter to the publisher calling this system has the most desirable new altered but perfected method in order to avoid the undesirable reactions of the vital energy, as he mentioned in aphorism 246 footnote. In the same aphorism, he discussed that the carefully selected medicine may be given for days and also for months. So he called this 50 millisimal potency as new dynamization method. He mentioned this in the aphorism 246, footnote 132. And he called it as Renault dynamization in aphorism 161, which is also the aphorism for homeopathic aggravation. 50 millisimal terminology was basically not given by Hahnemann. He always called it as new dynamization method or a new dynamization method or new altered but perfected method. It was Dr. Pierre Smith of Geneva. He termed this as 50 millisimal scale. And then it has other name, LM potencies. It was given by Swiss homeopath Rodolphe Fleury. And Q potency is called latest, was introduced by Jost Kundli. He was also a Swiss homeopath. So we all study this in the theory, but practically, especially for the students, when it is asked in the Viva, everybody says that it is called as 50 millisimal scale. So just focus on the terminology which was given by different stalwarts. So regarding preparation of this 50 millisimal potency, Hahnemann clearly mentioned in aphorism 270 and 271 and footnotes 150 and 157, 150 to 157. So I'm not explaining about the preparation aspect. The medicines are already available in the market. So the pharmacy part of preparation, I'm skipping it. Moving forward, mode of drug administration, which is very important clinically, has to be focused. Many students or many new upcoming practitioners have a lot of confusion about how to administer this 50 millisimal potency. That is what we have to revise once again today. So mode of administration of 50 millisimal potency was clearly mentioned in 245 to 248 aphorisms and their footnotes, especially about the preparation of the medicinal solution before you dispense it to the patient. It was mentioned in aphorism 247. And during the process of our administration, suppose if the patient is having any aggravations, then how to deal about with the sensitive patients, he has mentioned in aphorism 248 footnote 134. Then when to stop the medicine whenever you see the aggravation or any other symptom is mentioned in aphorism 161, which deals with the homeopathic aggravation, and 280 and 281, he speaks of return of the old symptoms, which indicates the real cure. So we need to just remember the principles of Hahnemann in our practice and refer whenever we have doubt. He already mentioned everything. So let's get into the main practical point. Methods to prescribe. Basically, we know simply that there are various routes of drug administration: oral route, olfactory route, and by external applications through skin. So this LM potency can be given in oral route in the two forms, solid dosage form and liquid dosage form. Solid dosage form is called as dry form and liquid dosage form is nothing but your water doses. So solid or dry form, you can give one globule only to the patient on the tongue. It is given for recent and moderate diseases. And Hahnemann said that this medicine will touch few nerves. If the same medicine, which is prepared with the poppy-sized globule, is titurated with sugar of milk, nothing but you just take one globule and mix it with few grams of sugar of milk and then crush it with the spatula or with the thumb. This above mixture is to be dissolved in water. Okay. Regarding water, he gave how many tablespoons of water in the aphorism 248, footnote 134. He said 40, 30, 20, 15 or 8 tablespoonfuls of water. How can you calculate? 1 tablespoon of water is 15 ml of medicine. So you multiply, you get the values. 600 ml, 450 ml, 300, 225, 120 ml respectively. And just for preservation, you need to add the small amount of pure alcohol as a preservative and stabilizer. Okay. Then you advise the patient to take 1 tablespoon of this mixture, which is dissolved in the water. This needs focus, so I'm just repeating once again. So the dry dose, only 1 globule can be given in the recent or moderate diseases, and this medicine will touch few nerves. And the water dose, you just have to take 1 medicated pill and mix it with few centigrams of sugar of milk. Approximately 0.81 grams of sugar of milk, and just crush it with the spatula or with the thumb and dissolve this above mixture into the teaspoons of water as mentioned by Hahnemann. 40, 30, 20, 15 or 8 tablespoons of water, where 1 tablespoon is 15 ml of liquid. You always have to add the pure alcohol, few drops of pure alcohol as a preservative and stabilizer. So orally you can give by 2 routes, dry route and by water dose. So the same he discusses in aphorism 248 footnote. He says, take a globule of thoroughly potentized medicine and mix it in 7 to 8 tablespoons of water, nothing but approximately 100 to 120 ml of water, and then give the succussions before taking the medicine. After giving succussions, the power of the medicine will be slightly changed. Take now 1 tablespoon of this water and again dilute in 100 to 120 ml of water. Then you ask the patient to take 1 tablespoon of water. If suppose during this process the patient has any aggravation, you ask him to dilute the taken 1 tablespoon into the second glass of water. And also if you see the aggravation, just take the third glass of water, fourth glass of water, and so on. So in water dose also we have 2 types. One, we just crush it with the sugar of milk, dissolve that mixture in the water and ask the patient to directly take after giving the succussions. Otherwise, you ask him to take the globule in the water, give succussions and take only 1 tablespoon and throw away the rest. If there is aggravation, you take this 1 tablespoon and put it in second glass of water, third glass of water, and so on, as it is mentioned in aphorism 248 footnote. So this is about the oral method, dry dose and water dose. Next, he also spoke about olfactory method of drug administration in the aphorism 248 itself. He said this olfaction can be used at an interval of 2 days, 3 days, or 4 days. Process is you just have to take one globule and dissolve it in 1 gram bottle, 1 gram bottle, add little amount of alcohol and give the succussions 8 or 10 or 12 depending upon the susceptibility of the patient before taking the olfaction. The smell should be taken for a second. Olfaction, you all know, will be followed when the patient is unable to take the medicine by oral route in case of lockjaw or tetanus, or in case of idiosyncratic patients, or the patient is in the ICU, not able to take in the coma state or not able to take through oral route, then we can go for external application of the medicine or the olfaction method. So he mentioned in aphorism 248 to do the olfaction depending upon the need for every 2 days, 3 days or 4 days intervals. If the stronger dose is needed, it has to be kept near one more nostril and one more small inhalation should be taken. Next, talking about the external applications, Hahnemann spoke about this in aphorism 284 and 285, 6th edition. He said that the medicine which you are applying externally, the same medicine should be given internally. And in aphorism 282, he spoke this when he was discussing about figworts. He says in that aphorism, if the figworts are not cured for a period of time, if you're giving some medicine externally, the same medicine should be given internally for the complete cure. So the same he's focused here. How can we apply this external application? You have to apply it on the epidermis just by rubbing or friction. Just avoid the parts where you have pain, spasm, or skin eruptions. This is about skin application. Then the specialty of 50 millismol scale administration is all about succussion. Why succussion is essential prior to taking dose? He says that vital principle is altered without any unnecessary aggravation if the succeeding dose is changed slightly. For rapid cure, the remedy must be changed in potency before the repetition. So the abnormal sensations diminish, bringing the rapid cure. Then how to give the succussions? Continuing the aphorism, in aphorism 248, he mentioned 8 succussions for hypersensitive patients, 10 or 12 succussions for hyposensitive patients to be given to the vial before every administration. Because the vital principle does not accept such unchanged doses without resistance. So to change the vital force for the positive, we have to advise the patient to give succussions before taking the medicine. How to prescribe this in acute cases? He says in acute disease, whatever potency in acute disease, we repeat for every few hours or every few minutes, 15 minutes, 5 minutes, 10 minutes, etc., depending upon the need of the case. Here also he says every 2 to 6 hours, and in urgent cases, every hour or oftener, you can give this potency. And in emergency conditions like heart attack, anaphylactic shock, intoxications, if we have a chance, we have to give the remedy every 5 minutes without forgetting to modify the dynamization every time. And in chronic diseases, he says we can give this every day or every second day, every alternate day. So the deep acting or long acting medicines also can be repeated for months without any unnecessary medicinal aggravation. So he says 1 or more tablespoons can be given. According to Hahnemann, he advises to give it at night time, 1 hour after dinner, and after taking medicine, the patient has to stay awake for 1 hour. This was given in aphorism 248. Depending upon the case, you can increase the tablespoonful doses. Yeah. So in the chronic diseases, we know that homeopathic aggravation will be at the end of the treatment, which is an indication that cure is almost or quite finished. If the symptoms are still there, then you can give this one or several pellets of the medicine until the patient experiences improvement. So repetition should be done when the improvement ceases. And when there is slow improvement in the case, you can repeat the dose. If there are new symptoms, you just retake the case and we give the necessary remedy. Suppose if there is homeopathic aggravation, what you do next? You just have to reduce the dose by diluting or just repeat the dose at longer intervals. Instead of giving it daily or every second day, just repeat it at longer intervals and possibly stop the medicine to observe whether it is homeopathic aggravation or disease aggravation. Yeah. So whenever there is homeopathic aggravation, you have to stop taking the prescription. And as per aphorism 280, when there are written of the old symptoms, which indicates the real cure, we have to stop giving the prescription. This is achieved by gradual ascending of the moderate doses, which are modified by succussion. Return of old symptoms means the vital principle doesn't need any similimum anymore to lose the sensation of the natural disease. It shows that vital principle is free from natural disease. Now it is completely under the control of the medicine, which is known as homeopathic aggravation. So when there is return of the old symptoms, don't give any prescription. Adding to this, further he says in aphorism 281, the patient should be left without any medicine for 8 days, 10 days or 15 days just by giving some SL. If the few symptoms are due to the medicine, it will be disappeared in few days or few hours. Then you will understand that it is completely homeopathic aggravation. If it is not the case, then it is original disease aggravation. In such case, you have to give renewed higher potencies of the remedy. You just increase the potency of the remedy if there is disease aggravation and give it to the patient, considering his susceptibility and irritability. First, always begin with the small doses and then go to the higher doses. Yeah. So difference between final aggravation, natural evolution of the disease and suppression. In all the three cases, initially after giving the medicine, there will be improvement. And during the evaluation, in case of final aggravation, which happens at the end of the chronic disease, there will be aggravation. In natural disease also, there will be aggravation. If it is suppression, the more important organ will be affected. So in this, if we don't give the medicine, in case of final aggravation, you will see improvement within few days or hours. And if it is a natural disease, there will be no improvement because this is the disease aggravation. Then you have to increase the potencies with the higher dynamization. And in case of suppression, if we don't give the prescription, then there will be improvement and more important organs are not affected. So in the follow-up, you always have to see Herring's law of cure, more important to less important, or above downwards. All those has to be focused in the follow-up. So potency posology is a debatable topic. It is all about matter of experience and observation. Without experiments, there is no experience. So as Hahnemann said, he always followed the series. But Dr. R.P. Patel, he followed the odd potencies, 0 by 1, 0 by 3, 0 by 6, and 0 by 8, and so on. So it depends completely on the experience of the physician on what potency to be given to the case. Either you give in the series or you give in the odd potencies. 50 millisimal potency works efficiently. So from the literature, Hahnemann has used Nux vomica and sulfur up to the 0/30 potencies. R.P. Patel, Dr. R.P. Patel has used graphitis up to 0/43 for curing a varicose veins case. So the limitation and the range of potencies is left to the experience of the physician. This is all just a recap of what Hahnemann has given instructions about 50 millismol potency. I chose a very small case which has come to me in the year 2022, which is very easy to analyze and come to the remedy. Select the simillimum very correctly. So this case is a known case of hypothyroidism. And the female, she came with the complaints of irregular menses. Sorry. Weight gain, irregular menses, and he had headache, left-sided headache. Yeah. So she complained of weight gain within a span of 2 months, irregular menses since 2 months, and left-sided headache. Whenever she was stressed about some family issues, mental aggravation, she had left-sided headache. So she was already using Tyronorm. Her diagnosis was in 2021, but she approached in 2022. She was using Tyronorm 25 mcg, and the characteristic physical journals in this case were she was having profuse perspiration, and she was having dreams of snake and clairvoyance. She explained this as her grandmother and grandmother's neighbor. She got a dream about them that they were dead. So it happened twice. So I considered that symptom, dreams of clairvoyance, and she was a hot patient and she was intolerant to tight clothing. Anybody who have studied the materia medica of Ophidia can say what is the remedy. Because it was very simple to understand, I have taken this case for presentation. You are right, I have given only lachesis to this case. The mentals were 1 year back, she just had a breakup with a boyfriend, and the boyfriend got married because he got a good match. And she was saying, it was my place. I was there, who was supposed to be. That some other girl was in my place. She was having some jealousy sort of thing. So I have taken that. And because she is the only one earning in the family, she had the responsibility of financial responsibilities and getting her younger sister married. She was feeling overburdened by the responsibilities and she doesn't tolerate criticism. So these were the characteristic mentals in the case. So before 2022, her menses was regular. But when she came to me, amenorrhea, she had amenorrhea since 2 months, and the last LMP was in the month of June. So normal totality of symptoms, I have taken characteristic mental ailments from responsibility, sensitive to criticism, jealousy, and characteristic physical journals, profuse perspiration, intolerant to tight clothing, dreams, clairvoyance, and snakes, and characteristic particulars, amenorrhea, left-sided headache, and clinical rubric hypothyroidism. This is actually a non-repertorial case, which I have directly prescribed lachesis. But just to verify, I have put all the symptoms in the repertory, homeopathic classic, and in that also, obviously, lachesis will be covered along with the other remedies. So I have given her lachesis 0/1. Yeah, after giving the lachesis, within 7 days, she got her menses. I was so happy because this was the case where instead of thinking centesimal potency, I gave the 50 millisimal potency, and in short duration of time, patient was happy, I am happy. Similia similibus curanter. So next month, there was no menses. When I decided to change the potency, I have gone to lachesis 0/2, same water dose, 1 tablespoon was advised to take after giving 10 succussions to the patients. And then she got her menses again. In between, she was having episodes of amenorrhea. Whenever she was having episodes of amenorrhea and headaches, because of the mental aggravation, I repeated the remedy, increase the potency. So this case went up to Lacasis 0/3, and now the patient is happy. Her thyroid levels also were normal, and she's having normal menses. And without informing me, she stopped taking Thyronorm 25 mcg, and till date she's not taking. All thanks to 50 millismol potency and the principles of Dr. Hanneman and our literature, which helped to cure this case. This is just a report. TSH was 7 before, and after treatment it was 2. So I take this opportunity first to thank my parents, my family, my brother, my teachers who taught me so much, and I'm happy to share in front of them. Dr. Ganesh Achari sir and Dr. Anil Kumar sir, they are here today. They shared their valuable experiences and so much of knowledge to me. Then I thank my college directors, principal, vice principal, seniors, juniors, all the faculty who were very happy knowing that I'm going to give a presentation here in HMAT. Thank you all for your unwavering support and encouragement. And finally, I thank the whole team of HMAT for making this happen. I value this opportunity so much. Thank you for having me today, sir. And I request all the audience to give a big round of applause to the team of HMAT who always work tirelessly to conduct such scientific sessions. Behind this, there is a lot of hard work, perseverance, and consistency. So whenever we have time, let's just come back to HMAT and evolve our knowledge. Happy learning. Thank you.
Thank you so much, ma'am, for your in-detail explanation about the topic. I guess ma'am deserves a big round of applause once again. Thank you for your presence. And thank you so much for extending your gratitude to Team HMAT, ma'am. Thanks. So now let us move on to the next session, that is felicitation. So today we are going to felicitate our speakers who took their time, who took their energy, and who have come here to share their aspects and knowledge on various aspects of topics of medical science. So sharing of knowledge always increases its aspects. Don't you agree that? Everyone is sleeping already? I guess now it is time to wake up with your claps because it is time to felicitate. So thanks to everyone. Clap for yourself for your wonderful presence over here and for your patience and for your curiosity to seek knowledge. So first of all, I would like to call upon Team HMAT, our General Secretary Durga Prasad Rao Garu, our ICRH Director Dr. Venugopal Gauri Sir Garu, Dr. CV Swami Garu, Dr. Ganesh Achari Sir, to please come onto the dais for felicitating the speakers of today's session. Please welcome them with a big round of applause, guys. I request Dr. CV Swami Sir and Dr. Ganesh Achari Sir to please come onto the dais. I would like to call upon Dr. P. Srinivas Sir also onto the dais to join the felicitation. Welcome, sir, with a big round of applause. Now I would like to call upon our first speaker of today's oration, Dr. K. Raghupati Reddy Garu, onto the dais to get felicitated from the team of HMAT. Thank you, sir, for your gracious presence and your wonderful knowledge session about the topic today. So give a big round of applause, guys. Thank you, sir. Now we would like to call upon the second speaker of today's oration, Dr. Boini Kavya ma'am, to please come onto the dais to receive her memento. Please give a big round of applause. Now I would like to call upon Dr. Venugopal Gauri sir to the podium to present the concluding remarks and continue the felicitation.
Good evening, everyone. Team HMAT and the honorable speakers of this evening and the wonderful audience. Thank you for being here. And it's always a pleasure and an honor to hear from someone who has practiced this trade. You know, we have so many homeopaths, but unfortunately, there are not many who practiced. But Dr. Raghupathi Reddy Garu, who graduated probably around 1987, where homeopathy was not known to many, and it was not in the favor of the systems of medicine at that point of time. There was not much of information. There was no social media. There were no other contacts who would actually tell you about homeopathy. There was not many complementary alternative ideas for treatment of various diseases. It was in those days that this gentleman has started practicing, and he has done well so much for the cause of homeopathy. And also not to forget the fact that he has practiced in a rural area, in a background where it is all educated people are there, literacy is there, people want to know more and learn from others. It is easier to spread the word of homeopathy. But Dr. Raghupathi Reddy practiced from Bhongir, and he's such a hugely successful practitioner that is carrying the torch of homeopathy successfully for the past 4 decades. Congratulations and thank you for being here, sir. And all the little remedies that you have heard, whether it is hepar sulfilation, ranunculus bulb for cons, or whether it is calcarea carb and dulcamera and the silicea for warts, and everything you have read about that in Materia Medica. But don't forget the fact that these have led to his huge success of practice. And as he rightly said, unfortunately, not many people reveal what they do. You know, in the scheme of things, for homeopathy to grow, it is always important that we share our knowledge. And we are happy to have a speaker who has openly discussed about all the successes of his various treatments that he has done. And thank you so much again, sir. Everything will be lapped down by all the not only the younger generation, but also practitioners, because as we go on in life, sometimes we forget the fact that there are some remedies and we need to look back. And this is a gentle reminder for all of us. And also glad to share that it will be on YouTube. So somebody who has missed writing something, or if your friends want to listen, you can always share the link with them. And I'm sure they will immensely benefit from that. And furthering the flag of homeopathy, making it proud, making our system proud, is a younger generation. Dr. Kavya Boini, thank you for being here, ma. And she's a wonderfully, equipped, knowledgeable, and a wise assistant professor in a homeopathic medical college, Hamsa Homeopathic Medical College in Hyderabad. And she has again gently reminded about the theory of the millesmal potencies. I think the last organon of medicine came to us after the demise of Kent, and he never read that. And it was in that millesmal potencies were in detail explained by Hahnemann. And probably if Kent were to read those, the science of homeopathy would have been different, for whatever it is. today we have that access to all the knowledge that is given in organon of medicine, and Dr. Kavya has come out clearly about each aphorism, what it says about the millisimal potencies and how it can be applied. And she has also given a case wherein the successfully treated one was shown. And as a matter of fact, homeopathic medicine doesn't have any side effects. And if there is any even millisimal possibility of a side effect, that is not possible with millisimal potencies. That is the beauty of millisimal potencies. Thank you for highlighting all those facts. I'm sure it is a great eye opener for many. And it is a fact that they are not easily available in the market, but now there are some companies who have come forward to make this. And I'm sure the younger generation and even the practitioners who have listened to you will be again reminded about the fact that this can be used very well in the practice in the days to come. Thank you so much, Dr. Kavya, for being here. And this is also an evening at the Homeopathic Medical Association of Telangana. And this is the last month of 2025. And we have some dynamic homeopaths in our circuit who always stand up for the cause of homeopathy, who love fighting for the reason for homeopathy to survive, and also for associations to survive, give their strength to the the pursuits of our system of medicine. And it is an honor for Homeopathic Medical Association of Telangana also to felicitate them this evening. And for the same, we have some beautiful young people who have done so. We will call them on stage and felicitate them. I request meanwhile our General Secretary, Dr. Durga Prasad Garu, to please come on stage so that we can felicitate the members. I request a senior practitioner and also our executive committee organizer, Dr. Ganesh Achari sir, please come on stage. And I'm sure all these people or the homeopaths will feel very happy to receive a memento and a recognition from also the senior practitioner, Dr. Raghupath Reddy Garu. So I also request to be on stage, sir. Dr. Kavya, please come on stage, ma, so that we can felicitate some people. Yeah, they will be happy to receive from beautiful young people also.
We would like to call upon our first invitee who is going to be felicitated today for their wonderful contribution in the field of homeopathy, Dr. K. Kavita ma'am. Ma'am, please welcome for the felicitation.
Dr. Kavita ma'am is always available for the cause of homeopathy, and she would regularly attend our outpatient clinic, serving whenever there was a requirement of a homeopathic physician. Thank you for being with us, madam, all the time. Thank you so much.
I guess it deserves a big round of applause for such a commitment and endeavors. Next, we would like to call upon Dr. Shika Kedia ma'am onto the dais for the felicitation. Please give a big round of applause.
Thank you, Dr. Kedia, for being here. She's a senior homeopathic practitioner of Twin Cities, does well for the cause of homeopathy, and she's always there whenever Homeopathic Medical Association of Telangana requires her services. Thank you so much, ma'am, for being here, and it's an honor for us to felicitate you this evening. A silent gentleman and a crusader for the cause of homeopathy, practicing since 1999, 1990, and very encouraging to juniors, happy with seniors, and always has a pleasant smile on his face. Dr. Naron, we request you to come on stage to be felicitated. Dr. Naron has been practicing for more than 30 years and a senior homeopathic practitioner.
Thank you, sir, for gracing this event with your presence. Now, I would like to call upon Dr. Bharadwaj, sir, onto the dais. Please give a big round of applause.
Young dynamic homeopathic practitioner, available not just offline but also online in social media, clearing the doubts of many. And there are many commonly asked questions and misconceptions about homeopathy, and he promptly replies to everyone and stands up for a cause. Thank you, Dr. Bharadwaj, for doing for everything for homeopathy. Thank you.
Next, we would like to call upon Dr. Anil Kumar, sir, onto the dais. Please welcome, sir, with a big round of applause.
Thank you, Dr. Anil Kumar Garu, for coming here, for accepting our felicitation. Thank you for all that you do for homeopathy.
Thank you, sir. Thank you so much. Now, I would like to call upon Dr. Sridhar, sir, onto the dais. Welcome, sir, with a big round of applause.
Dr. Sridhar Garu, practitioner for more than 25 years, now with NRHM and doing a lot of service, spreading the word of homeopathy through government means also. Thank you so much for being here.
Thank you so much, sir, for giving your valuable time to the association. Thank you so much. Now, I would like to call upon a young homeopath who doesn't miss even one seminar and who always be consistent to every seminar. Wherever you go in a seminar, if speaker comes late also, he'll come on time. That is Dr. Gunit Pal Singh. Thank you for always being a committed member.
Thank you, dear Gunit. And you will see more of him in the days to come after he is free from his MD. He's a good practitioner. He's completing his PG in homeopathy in the next few months. And he's always there for the cause of homeopathy. And we wish him a lot of success and happiness in the days to come through our system of medicine.
Next, we have a young homeopath in between us. So before telling why she is felicitated, we need to tell what she has achieved. So she is basically from Hamsa Homeopathic Medical College, and she have received an award from Governor of Telangana on for essay on topic at centenary year of independence, My Vision. And also her article was published in a newspaper, The Hindu, A Timeless Science of Healing. So it is a great achievement at a young age, and Homeopathic Medical Association of Telangana achieves all age groups and appreciates all age groups so that we can walk together. So give a big round of applause for an inspiration to the younger generation, D. Barasa.
Thank you, everyone. That ends the felicitations for this evening. And we'll have a special session probably associated with one of the corporate hospitals of the Twin Cities next month for Venibhushan Memorial Oration next month. We will update you in the days to come where it is and what the topic would be and who the speaker would be. And I'm sure it will be promising like this evening, and we'll have more content next time onwards too. Thanks for being with HMAT all the time. Your services are solicited for the cause of homeopathy. You're always welcome here for giving advice, suggestions, and work with the team of HMAT. Thank you so much. And 2024 and 2025 has been the season at HMAT for finding out or looking for young people who will serve the cause of homeopathy in the days to come. So we have found, or we have already seen in these 2 years, very beautiful performers who have made homeopathy proud, and we would love to have them on the stage in the days to come. I request our young team to be here who actually do all the services behind the scenes. Dr. Chamundeshwari, the electrifying performer this evening, you can see with me. Dr. Sai Shruti, please come and please come and join the podium. Dr. Gautam, please come and join the podium. Dr. Muskan Agarwal, Dr. Harshita Ure, please come on stage. Dr. Shashank Dhruva, how many of you have the idea about Hamara Homeo? So we'll give you the person who is behind the scenes. We are waiting. The audience is waiting for you, please. Dr. Gautam, Dr. Shashank, we have very little time. Dr. Harshita, Dr. Sarika, and we have some new blood who will spread more warmth for the cause of homeopathy. Dr. Shahista. Thank you so much. One snap with the youngsters, please.
Good evening, one and all. I know you are tired of hearing many things, but always extending gratitude is the basic minor essence of any seminar. So first of all, we extend gratitude to each and one and only and great doctors over here who always encourage the field of homeopathy and who always see greatness can happen in homeopathy and who always find hope and always spread hope in homeopathy. So today we had two great speakers, Dr. K. Raghupati Reddy Garu, who have delivered an enormous lecture on his topic, which was very knowledgeable. And then we had Dr. Kavya Ma'am, who have delivered a lecture on 50 minutes per scale, brushing up the topics. So one thing I want to say and ending this vote of thanks is always come together, always walk together, hand in hand with all the generations of grandfather, father, and then family or daughter, walking hand in hand together towards the garden of homeopathy to grow more and more